And away from that, the special advisor to the President on Health, Salma Anas, says the federal government is set to implement the mandatory salt target regulation. This will be part of measures to ensure that Nigeria conforms to the required sodium intake requirement, as recommended by the World Health Organization. TVC's Kemi Balogun has the details.
In many high-income countries and increasingly in low- and middle-income countries, a significant proportion of sodium in the diet comes from processed foods. The growing concern on the excess consumption of sodium is gaining more proactive measures to mitigate the burden of non-communicable diseases that arise from its intake. This investiture ceremony for a policy champion and social media influencer for salt target regulations in Nigeria is one way to do this. Special advisor to the President on Health, who doubles now as a policy champion for salt, says this will be done through several approaches, like promoting sustained advocacy on healthy living standards, as well as through the implementation of the mandatory salt target regulation.
I will also engage with key stakeholders, policymakers, health professionals, and the public to emphasize the importance of implementing mandatory, we call it mandatory salt target regulation. It is a must. We need to make a strong evidence-based case for these regulations to ensure they are adopted and enforced as part of President Bola Ahmed Tinubu's agenda.
I also dedicate the appointment to the countless Nigerians affected by non-communicable diseases related to excessive salt consumption. It is my hope that our efforts will improve their lives and the lives of future generations.
Globally, an estimated 1.89 million deaths are associated with consuming too much sodium. These experts say reducing sodium intake is one of the most cost-effective ways to improve health and reduce the burden of NCDs.
We have made significant progress, but there's still plenty of work left to be done. Let us continue to work together to drive change and create a healthier future for our country.
This excessive consumption of salt has been estimated to account for 10% of cardiovascular disease-related deaths in Nigeria. And I always say that this is an estimation. This is just like the tip of the iceberg. It's much, much higher than that.
The World Health Organization recommends that all salt taken should be iodized, which is essential for a healthy brain development in the fetus and optimizes people's general mental function. Kemi Balogun, TVC News, Abuja.